There are four possible ways that an implant can be inserted. The incisions can be made in the armpit. It can be made through the nipple or areola. It can be made at the bottom of the breast crease, or even the belly button. So I want to discuss each one and the advantages and disadvantages. Let's start with the belly button approach. One disadvantage has to do with the fact that only saline implants can be inserted through the belly button. Silicone implants cannot. But the bigger problem is the fact that the belly button approach has a very high rate of complications. This is so high, in fact, that the American Society of Plastic Surgeons does not even recognize it as a way to do breast augmentation. Another way to insert the implant is through the armpit. Although this sounds great, it also has a very high rate of complications. It has to do with the fact that it is very hard for the surgeon to control bleeding or to control the shape of the breast from the armpit area. And I know very few surgeons that use this approach anymore. Putting the implant through the nipple and areola used to be the most popular way to do a breast augmentation. But studies that have been done since then have shown that the rate of complications for this approach is also very high. And this makes sense because the surgeon has to cut through the nipple and go through all the structures of the breast to reach the muscle. And when they cut through this area, a lot of very important structures get injured. This includes the nerves to the nipple, it includes the milk ducts to the nipple, and the milk glands that are behind the nipple. This increases all of the risks of surgery. This includes nipple numbness, the inability to breastfeed in the future, infection, and capsular contracture. And for this reason, no top breast surgeon today uses the nipple as a way to insert the implant. The safest and the best way to insert an implant is through an incision made at the bottom of the breast crease. This incision avoids all the risks of breast augmentation. It avoids cutting through all of the important structures of the breast and therefore reduces the risk of nipple numbness. It improves the ability to breastfeed, and it decreases the risk of infection and capsular contracture. And for all of these reasons, this really has become the gold standard for all top breast surgeons. And therefore, it is a much safer approach. Better yet, it also creates the best looking scar because the incision and scar get hidden in the curvature of the breast that will form once the implants have healed and settled. So for all of these reasons, this really has become the gold standard way of inserting a breast implant. So although there are various ways to insert the implant, all of the studies have proven that inserting the implant through an incision made at the bottom of the breast crease is not only the safest way to insert the implant, but also creates the best looking scar.